The Supreme Court announced its landmark decision on healthcare reform, and now it's up to consumers to figure out what it means for them. More than 160 million Americans, that's more than half of the American population, are covered by insurance through an employer-sponsored plan, and a lot of them have seen their premiums go up quite a bit over the last couple of years, and they're kind of wondering what healthcare reform has really done for them. What can they expect in the years coming up in terms of costs?
Well, it's hard to determine right away what it's going to mean in terms of their premiums and deductibles, and whether premiums and deductibles will go up as a result of reform. What we can say is, for this particular group of consumers, 160 million Americans that you're referring to, the good news is that increase in premiums have actually slowed down for them over the past few years, and currently they're in the range of between 6 to 8% increase per year, and that's less from the 10% increase prior to reform. But in 2014, under the Affordable Care Act, what's going to happen is that the individual mandate provision kicks in, which requires everyone to buy health coverage or pay a penalty. Now, insurers are bracing for this, because what's going to happen is it's going to throw in millions of consumers into the healthcare system. These folks are going to be added to health plans, and many of these consumers will also be high-risk individuals. These are, individuals who have pre-existing conditions and are heavy users of healthcare. So insurers look to these type of individuals as more costly consumers for them. As a result, insurers will likely increase premiums and deductibles for everyone in order to offset the cost of these new consumers being added to the health plans.
What if you can't afford insurance? Say you can't afford insurance now, and now come 2014 you're going to be expected to buy insurance, or else you face a penalty. So what happens if you just can't foot that bill?
Well, you're right. By 2014, every consumer has to buy health coverage or else pay a penalty. But under the Affordable Care Act, another mandate is for states to establish what are known as insurance exchanges. These are designed to be online marketplaces that will sell more affordable health plans. And they're specifically geared towards attracting uninsured, underinsured, and small businesses who currently can't afford health coverage. Another thing about exchanges is they will offer subsidies to low-income individuals, and these subsidies will be based on the income levels of these individuals. And really, these consumers can apply those subsidies towards their premiums. Now, there will be some exceptions to consumers from this mandate. For example, if you belong to a certain religious group, or if you are an undocumented immigrant, or if your income level is below the threshold that requires you to file an annual income tax return, you will not have to buy health coverage beginning 2014.
What is the penalty if you don't buy insurance? How steep is this penalty? I mean, could you just decide, I'm not going to buy insurance and just pay the penalty instead?
You will have to pay a penalty unless you belong to one of these exempt groups. For individuals, the penalty begins at $95 in 2014, and it will jump to over $600 in 2016. For families, the penalty is over $200, or 1% of income, whichever is higher, in 2014, and that's going to jump to over $2,000, or 2.5% of their income, again, whichever is higher.